everyone, my name is Dr. Audrey Sue Cruz. I'm a third-year internal medicine resident in Southern California. I'm currently in my last year of residency. Very excited and very honored to be answering some questions for you guys today for iSocialMentor. Thank you for giving me this opportunity. Just wanted to give you guys some background about myself and kind of how I got to where I am. So I grew up in Las Vegas, Nevada. I went to college at the University of Nevada, Reno, where I majored in electrical engineering. I did college for 4 years, and then I went straight to med school, studied medicine for 4 years, and then I matched into my top choice residency program here in Southern California. And here I am in my last year of residency and very excited to be almost done. It's been quite a long journey, so have about 7 months left and very excited. So I just wanted to get started on the questions that you guys had. The first one was, have you received any type of mentorship growing up, and what value did they bring to you? So I did receive quite a bit of mentorship growing up. I didn't have one specific mentor that I was with for my whole life, but I basically had several different mentors throughout each stage of my academic career. And a lot of the times my mentors were just peers who were older than me and went through a lot of the things that I wanted to go to. So for example, when I was in college, I had friends that were med students that would kind of give me tips on how to do well in my classes, when to take the MCAT, things like that. So it really helped because they kind of went through everything that I wanted to go through as well, and they gave some really good tips. So my biggest recommendation would be to develop relationships with people who are where you want to be as much as you can. I know it's really hard to develop those relationships, but if you can find someone who is willing to mentor you and they have done, they've gone through the things that you want to go through, I would for sure see if they would be able to mentor you, because I think that's just such a great resource to have, and also a great support system to have as well. So the second question is, what was the transition like from high school to college? That's a good question, because I think it was definitely a very difficult transition from high school to college. I was alone, well, not alone. I had a roommate who was my best friend, and it was for the first time, we were away from home, our families were very far away. So it was basically up to us to make a study schedule, go to class, do our dishes and our laundry. So all for the very first time. So it was very difficult. And I would say it took me a good semester or so to kind of get into the swing of things, like being a grown-up and stuff like that. So it definitely takes some time. And to everyone out there, don't feel bad, if you're just starting out college or whatever, and you're kind of struggling, it does take some time. So I definitely struggled for sure. So just give it some time, and I think you'll be able to get into the swing of things. The next question is, you majored in engineering and completed all your pre-med requirements. How did you manage your life and study time? That's also a great question, because this is something that I continued to struggle with throughout college. Time is definitely very, very difficult to manage, but what I did early on was, right off the bat, I knew that I wanted to be a pre-med student. So I knew that I wanted to go to med school, but I also wasn't exactly sure. So I majored in electrical engineering because I loved math, I love electronics, I love design. So that kind of became my backup plan. So I did both engineering and pre-med, just so that I could, explore both options and kind of see where I want my life to go, even though I knew I wanted to become a doctor deep down inside. So what I did early on was I talked to a pre-med advisor, and I talked to my engineering advisor. I got a list of all the classes that I have to take to complete graduation and to get into med school. And I basically just sat down and wrote my schedule for the next 4 years of college, including summer classes and things like that. So I pretty much stuck to it, to the schedule that I made for myself, with the exception of a few classes that I dropped and that I took again another time. But basically I just had to start really early and made myself a schedule. And in terms of the day-to-day things, like how to manage time efficiently and things like that, I would recommend getting a planner or at least a calendar. And so what I did was I would write down, when all of my tests were, when all my assignments were due. Every day I would make a checklist for myself of things to get done, and I would try not to carry it over to the next day. So it was very fulfilling every time you check off something from your to-do list. So I did that, and I think that was very very useful and very helpful to keep me on track during college. The next question is, you received your bachelor's in electrical engineering, and why did you pick that specific major? So a couple reasons. I kind of said that I really loved math, design, engineering. I love analytical thinking. I kind of fell into this during high school, actually. I loved my calculus class. I know that's weird, right? I really enjoyed problem solving, and for some reason math just came really easy to me. So I wanted to kind of build on that and see if this could be a potential career path, even though I knew that I wanted to become a doctor. So it's kind of weird. I wanted to have a backup plan, but I also knew that I wanted to become a doctor. So I stuck to it. I stuck to electrical engineering, as challenging as it was, just to kind of see if that could be, a potential backup plan for me. And it was, it was such a great field to get into. I met a lot of great people, a lot of intelligent, very smart, very, very brilliant people in engineering that really are inspiring to me as well. So I don't regret going into engineering, and I think that it really made me into a better doctor, and I developed a lot of skills during engineering that really helped me out during med school. The next question is, what advice would you suggest high school students do now if they want to pursue a career in engineering or the medical field? So that's a good question, actually. So the biggest piece of advice would be to reach out to people in the community, or your counselors, any other resources that you have at your high school, to just get in contact with people who are doing the job and just ask them about their life and if they're happy, and if they, ask them about what they do on a day-to-day basis, and just kind of get a feel for, what they're doing, and see if that's what you want to do too, if that makes any sense. But another piece of advice would be just to develop some really good study habits. Stay disciplined. I know that's really hard in high school when everyone's having a lot of fun, but it's really, really important to develop these good study habits right away. Not right away, but kind of early on, because if you go to college and you kind of get into that whole party mindset, it's really hard to break out of that. So I would just make yourself disciplined early, and just kind of focus on your goals early on, and just make some goals for yourself and stick to the plan, basically. I know there's always going to be some variation to your plan, but keep your eyes on the prize, basically. I know that's really, really cheesy, but it's true. Okay, the next question is, how did you prepare for the MCAT, and when did you take it? So I prepared for the MCAT for about 5 months. So I took it after my third year of college, actually in May. So I started studying about January that time. So January to May I studied, and basically what I did was I took an an MCAT prep course through Kaplan. It was actually an online course. And I also I read Exam Crackers, which is like a series of books that is very succinct and very to the point. So I read that along with Kaplan. And I also did a lot of test questions leading up to the test. So about a month or two before, I did basically one practice test every weekend. And then I wouldn't just take the practice test, I would actually go back and look at the answers that I got wrong, and then kind of study that so that I could fix my mistakes the next time. Next question is, what was the transition like from college to med school for you? Okay, so that was a really tough transition, I would say, because in college, a lot of my studying was not memorization. So with engineering, we don't really need to memorize a whole bunch of things. It's basically just thinking things out, doing a lot of design, fitting things into a formula, doing calculations, things like that. I mean, I definitely still took OChem, I took all the biology classes too, which did require quite a bit of memorization, but not as much as in med school. So med school was like, everyone's throwing things at you. So much memorization. So it was definitely a difficult, very difficult transition, but I would say, you know, with everything, it takes a little bit of time to kind of get used to your study strategies. So what I did was I would just kind of write down all of my notes again. Actually, I would rewrite my notes, and then I would study it every night. So I would kind of repeat. The repetition is key. So I would kind of reread everything I just studied. Next question is, when did you start studying for step 1? What materials did you use, and how many hours a day did you study? So I started studying for step 1 basically, when did I start? So when second year of med school started. So I got that first aid book and I just kind of skimmed through it, and I read through parts of it as it correlated with, you know, my med school curriculum. But I didn't actually start like hardcore studying until the end of second year of med school. So we had, we finished school early May, and I took about 5 weeks of intense studying. Basically all I did was study. So what I did was I took an online course called Doctors in Training. So it's like a video course where they kind of go through first aid. So they kind of give you a video, and you go through first aid. They do workbooks as well, and they do questions along with you. And it really kept me focused. It kept me on a schedule. It was really good. I also did UWorld questions. So I did a lot of questions, but that I think was the most helpful, doing questions, because you can learn from, you know, the mistakes that you did, and doing the questions for some reason really helped me learn a little bit more. So if I could go back in time, I would definitely do more UWorld questions. Let's see, how many hours a day did I study? I studied a lot. So it was probably at least 12 hours a day, every day for 5 weeks. I know, like, that's really like scary, but it's only a small period of time, and it definitely pays off. And it's definitely, you know, step 1 is a big deal, and you'll get through it for sure. But as long as you put in the time and the effort during the time leading up to step 1, you'll do fine, okay? The next question I have is, you are a third-year internal medicine resident. How much longer do you have until you're fully done? So I do have 7.5 months left until I'm done, and I'm so excited. I cannot wait until I'm attending you guys. Like, seriously, like, I've been in school forever. So I'm very excited. 7.5 more months, and I'm planning on doing hospitalist after. So I really love inpatient medicine, and I can't wait to be in the hospital a lot more. Next question is, what are your long-term goals in your career and life? So I definitely have a lot of goals. Many of them in my career are to eventually get involved in academic medicine. So I do love to teach. I love to work with residents and med students. And so I would love to kind of stay in academic medicine. That's kind of my plan, and we'll see how far I can go with that. But just hoping to continue working in internal medicine. Who knows if I'd want to do, eventually want to do a fellowship in the future. It's still up in the air, but I'm definitely open to anything. And in life in general, I have so many goals, too many to say today. But definitely eventually starting a family at some point. You know, a lot of the times female physicians put their lives on hold to pursue their careers, and I'm definitely one of them. I won't say my age, but definitely, you know, a lot of my other classmates from college and high school all have families and whatnot. And of course, you know, you can definitely have a family in residency as well. You know, I'm definitely not gonna dissuade you from doing that, but a lot of the times we do put our lives on hold. So I'm really excited to kind of get my life started after residency. And then the last question is, any final thoughts, wisdom, or insight you want to share with students who are considering to pursue careers in engineering or medicine? So just the biggest thing is to really have a goal in mind. If you want to be an engineer or you want to be a doctor, figure out what you need to do to get there. And just come up with a plan and just stick with it. I know that sounds really cheesy, but I think it really works to have a goal in mind, and it keeps you going. And just another piece of advice is to ignore the haters, ignore the doubters. I certainly had a ton of doubters and haters on my way here. A lot of people said I probably couldn't make it, or you know, it's really dumb to do engineering and pre-med at the same time, just choose one. You know, I had a lot of these comments, A lot of people, I don't know if they had my best interest in mind, you know, or if they were just trying to, I don't know if they're jealous or whatnot, but regardless, if people are saying that to you, you know, just, you know, don't think twice about it. Just go for what your goals are, what your dreams are, and just keep going. And that's my biggest piece of advice. And if you listen through that whole thing, thank you so much, because that was about 15 minutes. You were such a trooper. Thank you for listening to that whole thing. And if you have any more questions, I would definitely be happy to answer more. Okay, so thank you guys so much, and have a good one.